Welcome to the Occupational English Test, also known as OET. This is the listening subtest. Let us look at the type of questions that usually come. The entire listening is divided into three parts, that is part A, part B and part C. Under each part, you have different types of questions which are based on different topics. Under part A, you will be given 2 consultation extracts which are about 5 minutes each. The consultation is usually between a health professional and a patient. The task type is ideally based on notes completion type. You will be given 12 questions each. They assess the ability to understand and note information about the patient. In part B, you will be given 6 short workplace extracts, about 1 minute each. The workplace interaction usually consists of team briefings, handovers, health professional and patient dialogues. You will find one multiple choice question for each extract. In part C, you've been given 2 presentation extracts about 5 minutes each. The extract is an interview or a presentation on 2 topics. You will be given 6 MCQs for each extract. This part assesses the ability to follow a recorded presentation or interview on a range of accessible healthcare topics. Here is a description of part A and what you must do in order to do it effectively. You will be given 2 separate consultations. You need to complete notes. 12 gaps are given for each consultation. You will hear a conversation between a healthcare professional and a patient or carer. This lasts for around 4 to 5 minutes. You will be given 30 seconds before the recording starts. You are suggested to read the questions and underline the words. Most of the information is based on the patient. You must listen and answer simultaneously. The questions are divided from 1 to 12 and 13 to 24. You might get statements or sentences where you need to fill in a word or a short phrase. They will be revolving around conditions and the treatment given. Here are some strategies to answer part A. The recording will be played only once, so listen very carefully for details. These details will have the patient's symptoms, medical history and treatment. If you are confused about the information, then look at the headings and subheadings for cues. While doing so, scan the notes to identify important words, especially words that are verbs or hint at what the treatment or the symptom is, such as described as, diagnosed with. The words in bold may be the answer to the gap. See if you can identify recent medical history, current medication, lifestyle choices, past surgeries and illnesses. At times, the speaker may use idioms and phrases, so make sure you familiarize yourself with them. Identify the correct information in long consultations. At times, not all information shared or the answer that you're supposed to write will be medical. That means it might not necessarily be medical terms. Make sure you look out for the patient's current and future treatment. Sometimes forms of medication, types of treatment are also mentioned, which could be the answer. Simply describe the treatment that they have been following so far. This could also be one of the possible clues to look for when you're listening to the conversation. You must practice strategies for completing the notes in listening part A in order to do it effectively. Now, this is practice 1. Your instruction has been given here. Time approximately 40 minutes. These are all the instructions that you should be following. This is where you will write your answers. You will begin writing your answers. This is a description that has been given. Now, this is how part A appears. You will be given the context here, and you'll have 30 seconds to look at the notes. Once you do that, the audio will play. And then using these clues that are mentioned here regarding the patient, the symptoms or occupation, you have to fill in the blanks. You will be given an attached file to this particular audio file to this particular extract. You must listen to that and you must answer. This is practice part A continued. Again continued. Until you finish all 24 questions in part A. This is the end of part A. Now let us look at part B. In part B, you will be given 6 different short recordings. Usually, the questions include identifying a gist or a summary of the information. It could be based on workplace communication. You must look for the speaker's purpose or any specific details depending on the type of question you are answering. The question types may also cover opinions, function, course of action. Sometimes you will find specific details within the interactions. The time duration suggested is not to spend more than 45 seconds in part B per question. You will get workplace interaction like briefing or handover. It is suggested that you take 15 seconds to look at the questions and 5 seconds to mark the answers, each of them. Now, you must listen and answer simultaneously. There will be at least one healthcare professional in each recording discussing a range of contexts. They are usually based on very generic hospital questions. You will hear 1 or 2 speakers. In most cases, there will be 2 speakers. Let us look at some strategies to do part B. For questions 25 to 30, choose answer A, B or C. This is how part B begins. In the previous part, you ended at 24. You will start with 25, which will go on till 30. This is your first set. They have generic hospital-based contexts. Ideally, you ask questions that are based on gist. Now, gist questions basically ask you for overview of information and not any specific detail. Here, the information may be rephrased, so it is suggested that you look for differentiating words or words that might be similar in meaning. Differentiating words can give you the opposite meaning, so then you will know that the information is not correct. The next, detail. Here, a specific part of the recording is suggested. You have to pay attention to a specific part of a recording. Check for synonyms or rephrased lines. Next, some questions may be based on the speaker's purpose. That could include what or why the speaker is talking about a particular topic in a particular manner. The next could be function based. It could be discussing or it could be asking you to select something related to what the speaker is doing or what the function of what the speaker is saying or both the speakers are saying is. You need to understand the actions that this language describes. Finally, opinion based. Here you need to identify the opinion of a speaker on the issue discussed. Pay attention to how the speaker says things and the attitude towards the topic. The next one you have is agreement-based questions. Here you need to identify what the speakers are in agreement about, listen to the conversation, and pay attention to the reactions of each speaker to the other's suggestions. You need to decide what the speakers will do as a result of the conversation or talk. Pay attention to anything that will be done later while listening to the recording. Be aware of when in the future the actions will be done. So these are the type of questions that could be asked. This is practice part B. This is how it looks. Your instruction is given here. As you can see, questions 25 to 30. This is your context. This is the question asked. This is the kind of recording you will be hearing. And these are your options. You need to select the best one within the context of the given question. This is practice part B continued. Continued again. Now this is the end of part B, the 30th question. Now you need to look at part C. Here you will be given 2 different extracts. They are presentation or interview style extracts. Most of the words will be indicating examples and theories. The time duration suggested is 4 to 5 minutes each. You will be given 90 seconds before the recording begins. You will get 6 multiple choice questions for each extract. You must listen and answer simultaneously. They will consist of workplace interaction and podcast style interviews and will cover broad healthcare interests or broad healthcare areas. The strategies to answer this are as follows. This is how your question will look. It will say, for questions 31 to 42, choose the answer A, B or C. So extract 1 will begin from 31 to 36 and extract 2 will begin from 37, go up to 42. Pay attention to the keywords in the questions and underline them. Understand the general meaning or the gist of the information. This part tests your understanding of the arguments, attitudes or opinion of the speaker, so listen actively. Try to correlate the words in the questions with the recordings. The questions can include results of trials, case studies, etc. So make a note of this. Remember to read the questions first. The topics are not specific to any particular field. As mentioned earlier, they cover general interests. If the topic is unfamiliar to you, do not worry. since the information needed to answer the questions is given in the recording. So listen carefully, make the right notes, match the right words and select your answer. This is practice part C. This is extract 1. As you can see, your instruction is given here. You are told that you will be hearing 2 different extracts. Your question is also mentioned here. Now, the audio will play and you have to listen to it and you have to answer. You will be given a description of what the audio is about, so you will have some idea of the context. You have to, of course, refer to the question and select your answer in accordance with the question asked. This is practice part C continued. This is practice part C continued again. Now, as you can see, once you're done with that, then you will hear the next extract, extract 2, the questions of which begin from 37 and go up till the end, that is 42. Continue listening to the audio. Once part C comes to an end, you will be given 2 minutes to check your answers and it will be the end of the listening test. So go ahead, listen to the attached audio file that we have provided to do this task. Once you're done, you can cross-check it with the answer key provided. Now here are some general listening tips. Familiarize yourself with the instructions. This is usually accessible to candidates across all professions, so anybody can take it up. Use the time given before the task to look at the questions. Read through the questions first during the time provided. Multiple choice questions require you to underline keywords in the questions and the options so that it will be easier for you to practice. Write clearly and legibly. In note completion questions, underline important words that appear before and after the gaps so that you can use them as clues and try to match the information with what you've heard. The recording will be played only once, so listen very, very carefully and record your answers as you listen. Fill in all of the gaps in part A. Select an answer choice for all of the questions in parts B and C. You will not lose marks for incorrect answers. That means you will not get negative marks. If you miss, just move on, return to the question later. It is suggested that you listen to general English accents every day, and that could include British, American or Australian. Try to listen to as many podcasts and videos as you can. This usually includes 12 different healthcare professions, namely nursing, medicine, physiotherapy, dentistry, pharmacy, veterinary, occupational therapy, speech pathology, dietetics, optometry, radiography, and podiatry. That is the end of this training video. All the best with your practice.